And so when we're thinking, again, and I'm trying to make sure that we're all thinking forward post-COVID-19. But again, one of the things I do want to say, it's very, very vital that we're thinking about, if we're doing emergency care, there's some of these things I need you to be thinking about and doing now. Post-COVID-19, once we move past May and know when the governor gives us the go-ahead order for child care facilities to begin to operate again, there are things that we already need to have in place and giving us the ability to move forward and do the things that we need to do to keep ourselves, our children, families, and staff safe. So some of the mitigation strategies, and these are things that I need you to think about. One of those are posting signs throughout your facility. You already post signs, but again, here we are, COVID-19 changes it just a little bit, and I want you to think about all of what you need to talk about the spread of germs, making sure that everybody understands what it is that they need to do to stop the spread of germs and to keep themselves safe. The link here takes you to some of that information for downloads. And again, I just want to make sure that you have something available to you. But again, making sure that these are in and out and around your facilities, in your classrooms, and in all your common areas, all your spaces where information needs to be posted, so individuals coming and using your facility can see exactly what they need to do. One of the things that I said earlier that you didn't hear, in early care and education, we know that this is one of the things that we've done close to healthcare. We're one of those industries where one of our primary pieces of work is making sure that we're cleaning and sanitizing and disinfecting our spaces. And children who are in our facilities at very, very young ages already know washing their hands, how important it is. And so we know that, but we also need parents and other people who are coming in to be practicing this. We need it to be primary on everyone's list. Another one, posting sign outside the entrance, restricting entry to anyone with symptoms. If people are knowing this before they're coming in the door, what you want to do is try to stop entry. And so making sure that people understand that if they have an illness or a respiratory infection, that these are things that you're asking not be brought into the child care facility because of what it might do as far as its spread within your facility. So again, inside and out, posting signs, making sure people understand what's needed and necessary. One of the things I want you to think about, and I know this one is difficult, but depending on your facility plan, thinking about how could you stagger drop-off and pickup times. You know when your door opens, you know your individuals are coming into your lobby area. They may be coming in. There may be a point of entry where parents are needing to sign their children in. But having numbers of people standing close together here would be very, very difficult, and also would be problematic as we're thinking about one of the things that we still will be practicing on the other side, which is safe distancing. And so thinking about how you might be able to do this now will help you on the other side when you start thinking about your drop-off and your pickup time. And also when you're thinking about your staff, and I didn't say this earlier, but I will say staff who are coming in and out, if they're using machines to hand touch and all of those things, thinking about how you can make sure that they're able to come in and be safe in doing that, and having equipment around, for example, sanitizers, so that you can make sure that people are wiping their hands and doing what's necessary. And again, standing 6 feet away from each other while waiting to actually punch in is advisable. And so staff, developing a communication plan for staff in the event that there is a positive case in a staff or a child, and making sure your plan of action covers making sure that you can communicate what the needs are, making sure that people understand that there has been an impact, but also making sure that they understand your plan of action and what it is that you're doing regarding the information that you have and what your next step will be. And some of these things are going to come out in some of the plans that we're crafting on your behalf that will come out and help you in guiding you in some of these, but some of what we want you to start thinking about is your current communication plan for staff and children. What do you need to update? On the last webinar, I gave you a document, or excuse me, in the webinar said, look at your personnel policies and procedures. You need to look at those if you have not. You've got a few days now to start thinking about that. But I also think you need to be thinking about your parent handbooks as well. Families and children, limiting parents and guardians to one at drop-off and pickup. And we know sometimes multiple family members or friends want to enter the facility for drop-off and pickup. And what you need to say is this is a limit. You need to have only one adult and one child. This is the only way you're going to be able to maintain your safe space and your 6 feet apart, and keeping everyone safe. And so again, this is one of those things to start thinking about. One of those that I want to have you think about also is no outside visitors allowed in your child care facility for activities, and that's regardless of their security clearance. And these are individuals, for example, volunteers who are coming in to do activities. Right now would not be advisable for that, regardless whether they have a background check clearance or not. At this time, we need to limit who's coming in, because that's the only way you can have some limit and containment to what's going on in your facility. However, I do recognize that you will perhaps have some maintenance or repair workers that need to come in. So in this case, what you need to do is make sure that these individuals need to understand that there has to be a log and that you're maintaining this at all times, and it includes the date and time that the person was there, and information, name, phone number, cell number, and email. One of the reasons for that, of course, is if you needed to get back in touch with your maintenance or repair worker, but this one is a little bit more critical in that if there is a positive case, this is one of those individuals who would actually have to be responded to let them know that they were in at the time and may have come in close proximity to someone who was positive. So again, thinking forward, thinking about the kind of detailed information that you need to have within your facility. And so within your facility, I want you to think about your families and your children and your staff as well. Developing a communication plan for parents, and again, your parent handbook, but making sure that they know what happens if there is, in fact, a case. What is going to happen? What are you going to be saying to them? How are you going to communicate that to your staff and to your families if there was a positive case in a staff member or a child within your child care facility? You will have to say that this has occurred. You will have to say what your plan is, excluding any staff or child with symptoms, making sure that you're saying that this is our way of ensuring that we can keep a safe and healthy environment, is that there are going to be some exclusions. This is one of the things, again, that you need to look at your current personnel and HR policies to make sure that you have language in there about what it is and what you're saying to your staff. And again, in your parent handbook, updating that as well. Cohorts of children and daycare staff, keep the children in the same group with the same staff every day and all day. We know how hard this is, but what we're saying is limiting the transitions of children moving from one group of staff to the other. If you're doing this, if you're able to limit that, what you're able to do is limit transference. What you want to do is think through your schedule and your staff, and we understand staff capacity and all of those things, but we really want you to think about what and how you can keep children safe. How can you keep them in the same group with the same staff during the day? Again, if there is any transitions, they really have to be limited to minimum as much as you possibly can. And again, this is going to be something that's going to be difficult. We understand the size, complexity of your program. And one of the things that we may still be looking at is limiting group sizes to classes to 10 or less. This will be difficult. We're talking about PFA classrooms and Head Start classrooms where we have either 17 to 20 children enrolled. So we recognize some difficulties with this. And so we're working on a lot of different detailed information, trying to think through all of these things that may be impacting how we open up. And so we may transition in before getting to full operation. Promptly isolating any staff or child with symptoms, including the use of a procedure mask, which again, in order to do that, you need the PPE, so that you can make sure that you can isolate. We do know some children are not able to tolerate masks, but the adults who are in proximity of those children will need to have those kinds of things so that they can keep themselves safe. And so again, we've got to think about how we keep ourselves and our children safe. If a child couldn't tolerate a face mask, then the staff assigned to that child should definitely have one on. Again, this is about safety. Limiting staff to one-to-one care for children who've been isolated. And so not groups of individuals, but you know who that individual is. You know that person has been maintaining all of what is required to keep themselves safe, hand washing, keeping their face masks, wearing gloves, all the things that they will need to protect themselves in this particular instance. And then following your procedures on notifying. Again, as I said earlier, start crafting those if you have not on what are your facility procedures on notifying parents and guardians. You have procedures on, for example, if there's an incident of measles, there's information that goes out to talk about measles. are now going to need to make sure that you can talk about if there's an incident of COVID-19. You got to educate your parents and their guardians on contacting their family physician. It is vitally important that children who are sick, parents who are sick, that they're contacting their family physician so that the physician can make some determinants about whether or not they need to be isolated, whether or not they need to be home and isolated and not coming into your facility. Those family physicians will give them guidance on what next steps they should have. And also that information should come to you so that you know what to expect as far as your families and children. Can't say enough. Clean and disinfect areas after the child leaves. Clean and disinfect, clean and disinfect, clean and disinfect. I can't say that enough. We know that you're already doing it, but these are the kinds of things that we're going to have to consistently do as we go forward. When we have a sick child in our classroom, we know certain things happen. We immediately take groups of children out so we can clean and sanitize and disinfect. We need to be thinking about what will be our protocol for doing all of these things in our facilities, in our common areas, and in places where children may have been playing or interacting. And so thinking through all of your policies, all of your procedures, all of the guidance, all of the communications is what's going to be key to our being able to get on the other side of this and have safe and healthy environments. And so the city, state, and federal response, I'm just going to move over to that really quickly. And that's just to make sure that, and a reminder that our state and federal funders are continuing to allow us to support you through the stay-at-home order, meaning that we're still able to pay you and your vouchers that are coming through so that you can continue to pay staff. It is vitally important that those salaries be paid. We have a commitment from our funders that we are working to ensure that these individuals are not having to figure out what else to do. These are not individuals who should be looking for other kinds of benefits unless they were already doing that. And we know because of some of the low wages, some people are. But as far as their salaries coming from you, they should have been and should continue to be sustained until we tell you something otherwise. As we're going through this stay-at-home order, our federal funder, Head Start, has given us flexibility that lasts through June. If we get a stay-at-home order that begins June 1st, it says we can come back, that would change that, but currently it is through June. The state has said when child care goes back, when we're able to reopen, at that particular time, we will go back to our normal status of salary and vouchering. For you, nothing changes. As we go through this, you're continuing to be funded. I do want to say one thing to you regarding your state child care assistance program and what we've already heard. One of the things that they're wanting to know, for example, those of you who've accessed the CARES Act funding, they will want to know if you've accessed the child care, that funding stream, the CARES Act, that has given you some additional funding within your house. And if so, they will be looking to make some determinants about whether or not they would pay, for example, the month of May for your child care assistance program. And so these are things that we are going to be working with you on as far as information that we will need, and I'm going to cover that shortly in this webinar. But again, I want you to think about making sure that you are continuing to pay salaries. For those of you who have partners, we need to make sure that they're continuing to pay salaries as well. That's protecting our federal dollars, and that is also protecting our state dollars. And so I've heard a few things out there, and we've been working, and I'm going to be working with a couple of agencies this afternoon. I'm hoping that those are just offline. Those are things that have occurred only a couple of places. But again, my reminder here is that the state and federal funders are continuing to allow us to support you during the stay-at-home order, which means you should be continuing to support your staff as well by continuing to pay their salaries. Governor's Office of Early Childhood Development has information on emergency child care and priority essential workers. Going to that website, there's a lot of information on the website about COVID-19, so we're directing you to keep up with what's coming up. They update the site. There's information there for if you are providing emergency child care, this is a place that you need to go. I suggest everyone go onto the website, keep up to date with what's being stated and information that's being shared. something new. Shy COVID Coach. City of Chicago, our mayor has launched a new mobile app. People can download the app to their phones, and from there, they're able to access resources and get health updates. This is a really quick opportunity for people to have a place where they can just tap and get up-to-date information so that they can be kept up-to-date and abreast of information on additional resources that are coming up, and some new things are coming up almost daily. We just want to keep people up-to-date on those, and also the health updates. We want people to keep up with what's going on across our city. So the Shy COVID Coach app is available. I suggest everybody upload it onto their phone. So the Office of Head Start, again, I just wanted to make sure that you have this accessible. The updates to wages, and I spoke to it a few minutes ago regarding the flexibility for us to continue to pay wages. And as it says here, the second paragraph, this flexibility remains in effect through June 30th, 2020, or the date upon which programs reopen for center-based services. And so I just need you to have that language, sharing that language with your partners, because we are getting questions about how long and when, and they're also asking the Office of Head Start. So to mitigate some of that, I'm wanting to make sure that you're communicating this information. If you have partners across the board, making sure everybody has the information. CARES Act funding, we talked about it before. One of the things that we do know is that some additional monies were added to the CARES Act. Here's a webinar if people still want more information. Going on, looking at the webinar, and then if you need to, you can also get a way to access some questions directly from Office of Head Start so that you can find out if you need more information. The last one on this particular slide is enrollment questions and answers, because Office of Head Start has given us general guidance on enrollment inquiries related to COVID-19 and closures. They want us to continue to work with families, and I thank you, and I'm going to pause for a moment and say thank everyone for all that you're doing with and for families. I thank you for the weekly updates that we are receiving. Is helping us. I'm pulling together a document that's going to go to the Office of Head Start and others, letting them see some of the great work that's going out in community. But when it comes to enrollment, what we want to do is make sure that we're doing everything to get our classrooms enrolled. Just as a reminder, prior to COVID-19, we were talking about the need to get the full enrollment, and we were not there yet. And so in this guidance, it talks to you about things that you can do. And so it answers some of your questions and answers about making sure that we're still working with families. Some of the flexibilities that are there. For example, yes, working with families who you had already identified on your wait list, and making sure that you can, yes, put those families in COPA and make sure that you're doing activities with them right now, and those things are definitely countable. And so again, making sure that we're moving ahead and getting families enrolled. So some of the website and links that I just want to make sure that you have for today. Illinois Department of Public Health, the community organization guidance. Some of the bullets that I gave you earlier came from IDPH, and you can find that at the dph.illinois.gov site. And if you look on the site, community organization guidance, there is one that you can tap on that says child care. It's a great place to go. There's a lot more information than I could ever include in a webinar, but I wanted to make sure you had the link as you're thinking about the kinds of things that you need to be thinking about and doing. cityofchicago.gov/COVID. Again, we pulled that up on the last webinar. I want to make sure that, again, this is one of those websites that you need to be going to often. You can go on and you can hear Dr. Arwady having conversations with Deputy Mayor Sybil Madison. It's a great place just to get updates and what's going on, and you can hear what kinds of questions other people are asking. And there are other links that you can tap into on healthcare and other things as well if you go to cityofchicago.gov/COVID. The latest coronavirus update from the Office of Head Start. Again, people need to, and you don't have to be a Head Start funded agency. You can be only funded by PFA-PI. I do recommend that you still go on, because the information that's shared is really great information to help you think about how you can keep your families and yourself safe. So again, going onto the eClick website is a recommendation that we have for you. Mentioned earlier, the Governor's Office of Early Childhood Development and here's a link for that website as well. What we want you to do is just stay abreast of every piece of information you possibly can. And I know there's a lot coming at you every day, as it is with us, and it takes a lot to feather through all of it to try to figure out which piece I should follow, what thing I should do. What we want to do is be your thought partner through this as we try to get to post-COVID-19. And so we're going to be figuring out for our next couple of webinars ways to be a little bit more interactive and think about ways that we can get some communications done that we would normally do if we had the availability of being with you in a room, which, believe me, we sorely miss. I sorely miss seeing all of you and being present with you, where we can talk instead of me talking to a device and not able to see friendly faces. But again, we understand the rationale and the reason for this, and this really is about all of us keeping ourselves safe, and the 6 feet apart is definitely necessary. So some of the things I just want reminders to go out to all of you. Delegates, you must actively work to engage your families at a minimum once per week, and then demonstrate those efforts in COPA, and you can put those into family case notes. We are, again, continuing to fund and continuing to make sure that you're getting dollars to support your staff. We understand staff are home using technology, and we have heard some of the most creative things that are going on out there, and I want those things to keep happening. But we still need to document those efforts. We still want you to send us the weekly updates, because that is going, for me, into a larger document that's going out to many more voices so that they can see everything that's going on. And so I bounce down to the one that says updates on overall engagement. And so all of the varying things that you're doing, what I want you to do on a weekly basis, and I know trying to summarize that in a paragraph for some of you, I understand you're doing a lot more. Go ahead, continue to give me all of that information. It's great for us to have it. What I need, though, is for you to continue to do that so that we can continue to package our information about all the great things that are happening in community with our families. And so the other piece, and I wanted to go back to this one, delegate, you have to be responsive to your family's needs. We know families are struggling out there. They need to know that you're there for them. And I thank you for everything that you've been doing, and you've been very creative in finding ways to do this. Some of you have been the benefactor of some additional funding that has allowed you to do a little bit more. But one of the things we need is for us to be responsive to our families' needs, including supplies such as diapers and wipes, and of course, making referrals. Families are struggling, need to know where to go to get information to keep themselves safe and to keep their families safe. And many of us, and I say us, because everything that we're going through right now, through isolation, through losing family members, all of us need to, in some cases, have the ability to talk to individuals to help us get through everything that we're bearing right now. When you think about your families who are struggling, some of them have not had the opportunity to work for many, many weeks. Their income has been completely decimated. They're trying to figure out just how to make it day to day, and they are depending still on you. And I thank you for everything that you're doing. We're thinking about ways that we can support you on this side as well, but we want to continue to be there for our families. One of the things that we know is if you're continuing to connect with your families, that's one key factor in your knowing whether or not your families are still healthy and that they're still safe. But it also keeps them healthier and safer when they know that there are people out there who care about them, that they can just say, I need, and you're able to find ways to support. Again, I thank you for everything that you're doing. It is crucial that we continue to work with, that we see, that we look at, that we are creative, that we find every vehicle and every item that we can to reach out to and support our families. Now, I remind you, you've got a cohort of staff who you have to think about as well. They are also isolated. Although you're paying their salaries, they're home working, trying to balance being teachers, being support of ill family members, and at the same time, trying to meet the demands that you are asking of them in order to stay in touch with their families. So I'm asking you to be mindful of that as well, staying in touch with your families to find out, your staff, to find out how they're doing. And in some cases, seeing what their additional needs might be and making referrals for them as well. Many of you have employee assistance programs, reminding your staff that those programs are only a phone call away. If you go onto the Chicago website, you'll find that there's a link there where people can make phone calls. Again, there's a phone call away for individuals who really need to talk to someone because they're balancing so much at this critical time. We also have to think about I call it brain health, many others call it mental health, but we've got to make sure that we stay healthy through this. I'm just as concerned about each and every one of you who are on this phone, and I'm hoping that you're doing everything that you can for yourself and keeping yourself safe, well, and healthy through this crisis as well. This is something that none of us at my age, and I won't tell you my age today, some of you already know it, but as we're thinking about this, I have nothing to compare COVID-19 to. And I know as a grandparent, when my grandchildren say, you know, well, you were born in the 1900s, and so do you know anything that you could compare COVID-19 to? And I have to remind them I wasn't born in 1918, so no, I don't have a comparison. But our families, our staff, and everyone are trying to figure their way through this pandemic. They're looking for support in many, many ways. And so I just want all of you to know that we're there for you. We're here to support you. We know that you're supporting your families and your staff, and we're asking that you continue to do this as we continue to go through this next month. We all hope that we can open up our child care agencies and our centers soon and be able to get those smiling face children back in the room, because I know you all miss them, as do I. I just want us to all be able to do this in the safest, healthiest environment we possibly can. What we don't want to do is find that this is now crushing us, and we have to go back and close our facilities again. So I want us to think forward. I want us to think together. I want us to be thought partners as we go through this. And I will continue to bring you up-to-date information and information to help you think through some of the things you need to do on your side. And again, readying yourself post-COVID-19. So some of the things that's coming up next, we are working on our COLA quality grant application. It is due May 15th. We have been given approval to do an abbreviated version. It's allowing us as a grantee to submit the grantee portion of this application and then submit the delegate approvals and some other documentation at a later date. But I just want to say, at that later date, when we're saying we need it, we will need to get those documented pieces of evidence into our system. And so staff will be working with you to make sure that we can get that information in. We're working on our side to make sure that we can meet the deadline date of May 15th and getting our application in. It did take some work to get an approval for an abbreviated COLA quality grant. We're absolutely happy that we have the ability to do that, because we recognize with the number of you that are out there, trying to get everything done under this circumstance we knew would be difficult as best. And so we're able now to go ahead and do an abbreviated version. Just want to make sure that you do understand that it is being submitted. The COLA, again, is a 2% COLA. The quality grant is based on the number of enrolled children, and those dollars, again, are going to be allocated. And so just want you to know that this coming up, there is a deadline date for that, and we're going to meet that deadline. So also next, we have we're going to do two more webinars, one on May 14th, another one on May 28th. And so as we're moving forward and pulling together documents and information, we will be over these next two sharing more information as it comes available to us, helping you prepare for post-COVID-19. And again, I want to try to figure out a way to do a much more interactive system so that we can hear from you and do some of what we would normally do if we were able to be in a room with you. The last thing on this slide, and we will be launching a survey, and we are going to be asking you for updates, and the updates from you, delegates, about your access to the CARES Act funding. If you applied for funding, if so, were you awarded, and we will need to know the amount. So again, we are going to launch a survey asking for updates from you on your access to the CARES Act funding. Again, those are federal dollars that were launched out there to go out into community, and you had access to those particular dollars. one of the things we need to know, and I need you to understand, we have also the federal grant, and so we're being asked to be able to document the dollars that are coming into the city of Chicago. So I will be launching a survey next week, asking for some updates from you regarding the CARES Act and funding. So again, chicago.gov/coronavirus is a place that you can go for information. And at the bottom it says, stay home and save lives. This I cannot emphasize enough. We are in a very critical phase right now in Illinois and particularly in Chicago, where we need to stay home. We know it saves lives, and we know it will allow us to all be here on the other side when we can talk about post-COVID-19. And believe me, I can't wait to celebrate when we're fully up and going, and we have an opportunity to be together and survive all of what we've gone through and talk about the stories that I'm sure there are plenty of. But again, just remember, stay home and save lives. And again, let's talk about it, let's think about it, and use all the resources that we've given you today. And so I know we want to hear from you. We're going to look to see what questions have come up. So we're going to pull it over and try to see what we have out there. The question is, does DFSS have access to be a priority agency to get needed PPE materials? Right now, Department of Family and Support Services, because we have homeless and shelter, we are receiving PPE for those. Those are priority right now. As we move forward, we're now talking about what we will need for child care agencies. And that is a conversation that I'm having with the department, right? And we will be able to get back to you on whether or not that's going to be, whether or not we will be able to access those resources. And so I'm going to get back to all of you on PPE as we understand the need and the concern about having those as we get to a point of opening our facilities. I think, Maria, your question is there TA to update policies and procedures? Yes, there is, and I will, in our questions and answers, I will include some information on how to access some additional services. We do have right now consultants working through the BACP, and we will be asking them, and I know they've worked with some agencies, we will be asking them to stretch their arms a little bit more. So we'll address that, but there will be information to come about that. Transitions that were planned from early Head Start to Head Start. As we're thinking about going forward, we do have to think about how do we transition children. Age eligibility will be determining children moving from early Head Start to Head Start. We would normally do that in the summer. It's hard to determine exactly when we get our doors open, but yes, we will be making determinants about transitions. And again, some of that will be coming very, very soon as we walk through both with our Head Start funder about making sure that we can determine exactly how we do that. We know what we would traditionally do as far as our COPA data system and rolling over in September and doing all of those things. But what we're thinking about right now, and your question about what is your plan from early Head Start to Head Start in the summer, I say plan forward, know how many children you have in your current early Head Start program that would be transitioning into Head Start. We will be looking at some of the same things that we usually do when we're doing, for example, getting COPA ready for the next season, is asking you to identify the number of transitions in the COPA system, so you will have a handle, we will have a handle on the number of children that will be moving as we ready ourselves for what we would believe at that time would be our start of our new program year in September. My hesitancy, if any, is that we're still sitting here and we're still in active stay-at-home order. As we move forward and we get closer, we'll understand more about dates for all of these things, and we will have more information that will be coming out. Are you saying that after opening we will still have to limit? What I said, and I said we, as we're going forward, we're looking at how to keep ourselves safe. What I said in that is we currently have, right now, those who are doing emergency child care have to limit their groups to 10. Those are some of the recommendations. I'm not saying that's what we're going to do. I just want you to start thinking about if, for example, we got to a point and we said that we had to constructively only have small groups. If we're saying we need to think about how we space children in our building to keep them apart from each other, I want you to think forward. Right now, it is impacting us as far as our emergency child care. We will know more as we get on the other side of this, and we are able to plan for a full opening for child care, whether or not that's going to be one of the constrictions that you will be operating under. But if you had to think about that, what would it look like in your facility, Brenda, and others? Right now, that's what we're doing for emergency child care. I'm not saying that it definitely will, but what we know right now is what we found is keeping smaller groups means that we've been able to have safer environments. And so, yes, those are things that are being tossed around. I'm putting it out there just as a thought provoker. I don't have anything that says we will have to do that, but as we move forward over the month of May, we have more information, more people are talking about it across the state, and we're making some decisions about that. More information will be shared with you as we come back in our May meetings. Is there any way that parents can choose to be remote so that classroom size limitations can be met? Again, I don't know when we get down, and thanks for the thought, and all of these are ways for us to think about it. We would have to work with our funders, again, to see whether or not capturing a parent after we reopen, if they're remote, if they're still captured as a parent. Again, these are things that we're putting out there as options, and we'll see whether or not we get the ability to do that. For example, a mom is home, just giving you an example. A mom is home, she's working, she's at home isolated because of COVID-19, for example. So for a short period of time, she's unable to bring her child. Might we be able to do something like that so that we can keep that child steady as enrolled? That might be a possibility. These are possibilities that's being tossed around, Tracy. We just want as many thoughts out there so we can think through and offer up this kind of information as we're planning forward. Maybe what we're planning forward is a smaller transition, meaning some classrooms open, smaller groups, some other classrooms come online, some others come online. Again, we've got to think through. We've got a huge number of classrooms across Chicago and over 100 delegates that we're working with. So for us, the city of Chicago, this is a huge undertaking as we're thinking through what's going to be the best thing for you as you're thinking about opening. We understand that the 10 children in the classroom would affect your funding as we're going through this. If that's what we're having to do, we will be working with our funders at the exact same time. Looking at, again, how many in one space and what other space. Again, these are all the kinds of things that are being talked about. I am not saying that this is what we're doing. I want you to think about it, what we're saying to our funder, for example, and you know, they're staying on top of Chicago, and right now they know we have another 30-day stay-at-home order. They want us to continue to keep them abreast of what the thoughts are around opening child care centers. They're looking in other states, for example, that have been able to bring some of their classrooms back online. And in some of those classrooms, they literally structured spaces where the children stayed away from each other in the environment. Some classrooms would allow for that, some would not. And so we have to really, and again, what I'm asking you to do, you know your environments better than I do. I need you to think about your environment and what some of the possibilities would be as far as safety and bringing back programs. And you know, another question about PPE, I'm sure there are many more questions about that. And again, more information to come about our access to PPE and our ability to help you with some of that. How will you be able to use how will providers be able to use their brief judgment when it comes to operating? Some areas are harder hit than others. How to deal with parents and or staff who do not want to or continuously fail to comply with the new safety measures. That is an absolute concern, Zuli, and one of the things, that's why we're saying make sure that these are in policies, that they are written in procedures, so that when individuals are not complying, you have something to fall back on. That's going to be a requirement for all of you, is that things are documented. But a document that hasn't been shared and people haven't had it and don't understand that these are the new methods, then people will say they didn't know. I say give people no opportunity to say they did not know by making sure that your new measures of safety are in the hands and consistently understood by all, and that they understand, if not, then what. That's why your HR personnel policies, for example, for staff are so vitally important, so that they understand what to do. Can we explain what is required for data? On the last email, it was stated that we needed to capture data into TSG. For us, it's high scope. And how do we accomplish that? And we are e-learning. And we put it out for TS Gold. We didn't do it for high scope because that's not one where the documentation is coming in on a consistent basis to us. And so that will be a follow-up conversation. Deanna, I would like to have a conversation with you about that, specifically regarding high scope. So if you could please email me, to Rachel Burgess Burnett, then let's have a conversation about high scope. Have there been conversations about having all staff tested prior to returning to work? We've not had that conversation as of yet. I'm not saying that it's not going to come up. We are just convened as of yesterday a working group around the things that we need to be thinking about, and asking everyone to list the varying questions and concerns, and I will add that one to my list that I will take forward to that working group, so that, again, the working group that I'm talking about is with the governor's office. It has representation from health. It has representation from colleges and universities. There's a large group of us, city, the mayor's office, and others are represented to talk about the kinds of things, including this one. I just want to say this one, and this is just one that I think we all need to understand about testing. And, you know, we're moving, and I know the governor is asking, and I know the federal government has been working on it, but we've not gotten to a point where 100% of everyone can be tested irrespective of symptoms, and that's one of the pieces. And so wanting to have the conversation to say, because the work that we do, close proximity to children and families, lifting your voice is how we will take that forward. So thank you, Maria. The weekly updates, right now, what we were saying is you could send them directly to the supervisor of your teams. They're documenting those, and they're sending them forward to me. But please go ahead and send those to the supervisor of the team, the monitoring team that supports you. Again, they're documenting them, and then they're making sure that it comes to me so that it can be included in my report. Thanks for the question, Will. Roseanne, I'm going to go ahead because yours is their form. No, there is no form. All we're asking you to do is send an email. It can be a paragraph if you have other information that you want to share. It doesn't just have to be a paragraph, but just make sure that you're sending that to your supervisor of your team. And they are getting those to me so that they can be compiled. So thanks for your question. The question, Zuli, if the governor lifts the stay-at-home order June 1, but providers want to stay closed another month based on what they see in their particular zip code or immediate area, can they do so without financial penalty? Zuli, at this point, that will be one of the questions that we will have to work with this team that comprises individuals from the governor's office. But I will say with the federal funding, and if you look back at what's in that slide that I gave you, it allows us to fully fund you from the federal side and until the stay-at-home order is lifted. And so we'll continue to work to see But again, I do know that there are zip codes and there are areas that are much more heavily impacted than others. But I do know that we're working now in conversation this month and readying ourselves for us to get back and actually have the ability to open up our facilities after the stay-at-home order. The quality grant funding, is it separate from the COLA? We are doing one application inclusive of both COLA and quality as required by HHS. Those dollars are a dollar amount per enrolled children, and that's what we are applying for so that it then applies across. And we will send out more information about an explanation about COLA quality so that you understand that a little bit more. What are the implications for organizations that have received CARES Act funding as related to DFSS contracts? Right now, Dara, I have not received any, but they are asking questions about who has received those dollars. That's why we're doing the survey. The only one where there is a distinct piece, it has to do with CCAP, because the state dollars that support CCAP right now are supporting emergency care. We need those dollars to be there for you once we are able to open up programs across Chicago and across the state. And so we're looking, I know the state is looking at agencies who receive CARES Act funding to make some decisions about the child care funding reimbursement. And once we know more about that, we will. But again, we're launching the survey so that we have information. Are the historical forms that we've used for COLA changed? Can you issue these forms as this is a good time for agencies to complete this? Scott, I will take your message forward. I know that there is a date that our person who's working on our COLA grant will be getting information out. I will make sure that I carry your voice forward on that. I have a family who's up for their redetermination that has to do with CCAP, but mom has lost her job due to COVID. I will push that one forward right now. All the families that are in, as you remember, Linda, right now, I know that the DFSS staff are working on redeterminations that were coming up. I do know that, I don't have the case specific. So what I will do, Linda, is ask that you reach out to your staff person here at DFSS regarding CCAP and pose that question about your family concern that you have that's specific to you. Thank you. In the future, we do not get an incident where a child's staff has been identified as having COVID-19. Will we need to close for 14 days? So if in the future you get an incident where a child or staff have been identified as having COVID-19, there are specifics to that question that you are going to get information on what you need to do. But again, the incident of the person having it, the incident of the person having been in your facility or not, all of those are pieces of information that would need to be understood in order to determine that, and that's the guidance that we will be sharing with you to help you understand that. If you go to the IDPH website, the link is in the system. Some of that guidance is there for you as well. A partner site should not be open as an emergency child care site if they have federal dollars. What we have said consistently is if there are federal dollars in a site, in 99.9% of the cases, those dollars are being used for more than just staff salaries. For that reason, if there's been equipment that's purchased with the federal dollar, if they've used the federal dollar for supplies, then that grant is now at risk at that particular site as a result of them having a license and opening for emergency child care. I have a couple that I'm going to be talking to today as a result of it. And yes, it is an issue, and no, they should not be open as an emergency child care facility. I'll give you one where the individual has stated, but the staff that are operating in my facility, for example, are only the staff that are paid through CCAP, and that my staff that are paid through Head Start and Early Head Start are receiving their salaries as has been requested and required. And I'm glad to hear that, but what I will say is we still need to get to the bottom of where the federal dollars, were any of those dollars used in that facility. And I use that as an example to help you understand what all we have to do if someone is doing any of this. Mm-mm. COVID symptoms can look like flu, absolutely, and that's why we're going to be leaning on IDPH and CDPH as we try to give you the best information that we possibly can about your response mechanisms around all of this. And again, just remember, we are here and we are going to come into a flu season very soon as well. And so abilities to try to determine what your response mechanism will be really will be led by the guidance of the health department to help us understand. And that's why we are doing everything we can on our side to get information, pulling all of this together so that these will be guidance points for you as you move forward. I'm going to answer a few more, and then we're going to pull into using these for our FAQs. Do I see or foresee change in implementing home visits from the way that we are conducting home visiting? Right now, Asozena, thanks for the question. As we come back and we move forward, because we have all of the models as a grantee, we will have to look at what we're saying as far as going into homes. Because one of the things that we do, we want our staff to be safe. And so that is one that is on the table, and it is a discussion point on what do we do when we get on the other side? How do we say to a home visitor not to go into homes? And so we have to construct the guidance for that as we're constructing guidance across all of our models, and home visiting being one. Tanika, great thought. The ability to offer an AM or PM to ensure services are offered to all children rather than picking and choosing. Thanks for that. We will add that to the list of things for us to think through as we're moving forward. Anything that adds to our discussion factors that we can push up, we're looking at some of your questions as ways to help us with that as well. So Scott, you have one here that goes into blanket waivers for disabilities, in-kind, full enrollment. We are monitoring, working with Office of Head Start in our region across all of those. And as soon as we get guidance from them, then we will be sharing that guidance with all of you. Again, Office of Head Start will let us know what we were able to request waivers for, including staff credentials. So thank you. Again, Heidi, it's a thought. Again, I will add this, and I'm going to go through and put all of the ones together about some of the ideas of how to get to 10. And your recommendation is Head Start, classrooms, PFA, split the rooms into 10, have one teacher with a group and another teacher with another group. Again, great idea. Again, this is what we're asking for, is that we all think about ways to do this, and we're pushing that up to the group as we're thinking through how we might be able to respond to this. And so I'm going to do one more, and then we'll pull all of these down and use these as Q&As that will go into our FAQ. And also many of these we're going to push up to the state group that's also thinking through how do we come back on the other side of this. Cindy, this is a great question. It's a concern that's been raised not just by you, but by many of our other delegates. And the question is, what if we open and families are not returning? Can we determine if we should remain e-learning? The question is twofold that you're asking, Cindy. And one of the things that I'm asking, and that's one of the things that's going to be really, really helpful, because parents, just like yourself, want to know if they're going into any facility, they want to know that it's safe. We're hearing that about staff in other facilities across the city of Chicago as well. One of the things is, that's why I'm saying, updating all of your documentation and all of your communications, because you have to let parents know that you have systems in place to keep them and their children safe. They need to understand what you've done as far as cleaning your facility. They need to understand that you have protocols in place. They need to know that this isn't just, we got here, we opened, and welcome back. They need to know that we've thought this through consistently and that we are doing everything that we can to make sure that we haven't missed things that would mean that we would open up any of our doors and we would not be safe. Our parents need to hear from us. They need to hear from you. They need to hear citywide that these are things that have been done and that will be done on a consistent basis. I will tell you that I work here at Department of Family and Support Services, and having staff feel more comfortable has been having them be able to see the facility staff, for example, doing the detailed things that are necessary to keep us safe. I say that, Cindy, because again, parents need to know it, they need to see it, but then they also need to witness it coming in. They need to be able to see and know that these things are being done with and for their children. Your staff are going to want to hear the same thing from you. Staff are fearful of coming back as well. That's why communicate, communicate, communicate. The first piece of that is to write your procedures, your policies, inclusive of all of these things. Update your policies and procedures. Update your parent handbook. Make sure that they understand. Address your concern that you think they're going to have, meet it head on, and give them information about what you're going to be doing to offer them a safe and healthy environment for their children. Allay some of their fears. We believe some of them will come back. So at this point, I'm going to bring closure to the webinar and say, I thank all of you. I thank you for everything that you are doing every day. I thank you for your thoughts that you put into this stream. Many of those, again, I will push those up to the committee where we're working so that we can use some of these as thoughts across the state. The city of Chicago, us, DFSS, we have a large job ahead of us when we think about the hundreds of classrooms and the thousands or tens of thousands of children that we service every day. And then on top of that, the thousands of staff that are in our program. What we want is a safe and healthy environment. We want to know that everybody, you, your staff, every child, and every family has been thought of as we're making our plan and crafting what it will look like when we get post-COVID-19. So I thank you again. We will be back with you for 2 more webinars next month. Every time we're with you, we want to hear from you. I thank you. I thank you. I thank you. Continue to do what you're doing every day for children and families across Chicago. They thank you. We thank you. And we want to be here with you as we have a celebration when we can get on the other side and be fully operational. So looking forward to the future. We'll talk to you soon. Thanks, everyone.